Hi, my name is Emily Fusco. I'll be the physician assistant student taking care of you this evening. What brings you in today?
I've just been feeling really tired lately, like pretty fatigued, even though I'm getting like around 8 hours of sleep, which is what I normally get. Nothing's really changed with my sleep habits, but I've just been feeling pretty exhausted recently.
Okay, and I'm so sorry. I wanted to get your name as well, just to confirm your name.
Yep, my name's Ryan Sullivan,
Okay, and do you identify as a male or female?
male.
Okay, all right. So you said you've been feeling just really tired recently?
Yeah, just like really tired, even though my sleep's pretty much been the same.
Okay,
Lasted about 8 days probably now, so I figured I'd come in and get myself checked out.
okay, great. And then Ryan, what do you do for a living?
I'm in high school, so I don't have a job currently. I just go to school though right now.
Okay, great. Okay. And prior to this, recently feeling tired, how's your general health been, would you
It's pretty
say?
good. I'm pretty active. Um, I run track and cross country, so I
Okay.
feel like I'm in pretty good shape.
Yeah, good for you. That's great. Okay. And I'm assuming in high school, are you single?
Yes.
Okay. Not in any relationships or anything like that.
Nope. Not.
Okay. All right. And do you have any significant past medical history that we should be aware of? I will go into detail further into the examination, but
Not that I think of. I was pretty healthy as a child. I usually try to eat pretty healthy and drink a lot of water.
okay.
Um, yeah.
Okay, great. And following up with that question, have you had a history of past admission within the last 6 months to the hospital or anything
No.
like that?
Mm-mm.
Okay. All right. So now I'm going to dive into your chief complaint of feeling tired. Okay. So you said that they began about 8 days ago. Is that correct?
Yeah, it was around 8 days. Yeah.
Okay.
Feeling pretty.
And can you kind of describe um, this tired feeling for me?
Yeah, so pretty much I woke up about 8 days ago. Um, and just from that moment I woke up that day, I was just like felt like extra tired and just really fatigued in general. And it wasn't really like associated with like a lack of sleep. Um, just
Okay.
felt like tired for some reason.
Okay. All right. And would you say that you have gotten progressively more tired within the past 8 days, or has it been just about steady for you?
I would say it was steady, pretty much the equal amount of tiredness every day.
Okay. And you said that you weren't getting any lack of sleep, but were there any participating events before you started feeling this tired feeling?
Nothing that I can really think of. Um, it was on like a Tuesday morning maybe, so it's after I got through Monday and after the weekend, but other than that, I don't think there was anything that I could think of that started that.
Okay. All right. And does anything make this tired feeling, does anything make it better for you or worse?
No, I haven't found anything that makes it better.
Okay. All right. Have you been doing anything, tried to drink like coffee to try to wake you up a little bit or anything like that?
Yeah, I've drinking coffee a couple more. I usually drink a cup of coffee in the morning, but I feel like it kind of gets me going for a little bit, but then after that, I just feel like that same fatigue that I felt before I drank the cup of coffee.
Okay. All right. And you said it wasn't getting any worse, so it's kind of been gradual about
Yeah,
the whole time. Okay. And has this ever happened to you before?
no, never.
Okay. Um, is there a specific location where you feel tired, or is it just generalized all over?
No, it's pretty generalized. Just basically with like a couple of periodically like body aches, and then it just kind of just my whole body just feels weak and tired, I guess.
Okay. And I know it might be difficult to kind of put this on a scale, but on a scale of 0 to 10, 0 being not tired at all, 10 being you're gonna pass out and fall asleep, where would you rate your tiredness?
I would say about a 6
Okay,
or 7.
okay. And you said it's no specific site for you.
No, it's just kind of like throughout my whole body, pretty much.
Okay. Have you had any other symptoms that kind of accompany this tired feeling?
Yeah, a little bit after I was feeling tired, like probably couple days after that, I started getting like a little bit of a fever, and even like a little bit of swelling like in my stomach in this area right here. If you can see
Okay.
it right here.
Okay. All right. So I'm just going to kind of go back over and I want to make sure that I'm covering all my bases, making sure I want to see where your fever started and same thing with your abdominal pain. Okay. So I'm going to kind of repeat the questions that I just previously asked you.
Mm.
So again, with the fever, when did that start? You said after this tired feeling?
Yeah, it was about 2 days after I was feeling tired, so probably 6 days ago, I guess. And
Okay.
I've just had that ever since.
Okay. Gotcha. And again, with the fever, was it sudden or was it more gradual?
Um, I would say more gradual. It's kind of the same with the tiredness. I kind of woke up that one morning and woke up with a bit of a fever. I would say
Okay.
it probably gradually got worse throughout the day.
Okay, got you. Do you have a thermometer at home? Have you been taking your temperature? Has it been wavering at all, or has it just been consistent?
No, I haven't taken an actual measurement of it. I've just felt just that I've had a fever and a little bit of body aches and chills just associated with that.
Okay, all right. And again, nothing you were doing before the fever that you think might have caused you to have a fever or the tiredness.
Nothing that I can think of really.
Okay. And then with your fever, does anything make it better? Does anything make it worse?
No, I don't really believe in taking non-prescription medication, so I haven't taken any over-the-counter medications for it or anything to try to make it better, just because I try to keep that medication out of my body.
Gotcha. Okay, that's okay. And you said that it has been getting worse. And has this fever ever happened to you before? Have you ever experienced anything like this?
Yeah, I've had fevers like it before, I would say, but yeah, I would say I have. Yeah,
Okay. Gotcha. All right. And on a scale of 0 to 10, where would you rate your fever at if you could?
I would say about a 5 or 6 probably. It's
Okay.
nothing too crazy, but
So
it's just.
about the same with the lethargy, the tiredness. Okay.
Mhm.
Um, and you said the fever is persistent for you, correct?
Yeah, yep. It
Okay.
lasts pretty
All
much
right.
all day.
Okay. Again, I'm going to ask you those questions associated with your abdominal pain now. Okay. All right, so where would you say exactly your abdominal pain was? I know that you pointed to the upper left quadrant. Is that correct?
The upper left quadrant is where it's kind of like tenderness on touch, and it's a little bit swollen there. I
Okay.
usually see.
Okay. And when did that begin to happen?
That kind of arise with the fever. I woke up one day and I noticed that it was kind of tender. I woke up on my stomach and it just felt weird, and then I noticed that there was a little bit of swelling there.
Okay. Um, and was that abdominal pain? It sounds like it was sort of like a sudden onset for you. Is that correct, or would you describe it more as gradual?
I would say I woke up when I went to bed. It wasn't there, so then when I woke up, it was there, and I would say that it gradually got worse throughout the day.
Okay. All right. Has this ever happened to you before?
No, never.
No, okay. And with the abdominal pain and the tenderness and the swelling, does anything make it better or worse? I know you say that you aren't really into taking over the counter medication, but I wasn't quite sure if you tried any other remedies.
No, I didn't really. I haven't tried anything else. I just try to avoid laying on my stomach just to avoid that the pressure on there.
Okay, so does that make it worse for you?
Yeah, if I lay on my stomach, it does.
Okay. And would you describe your stomach pain as getting worse?
Ever since the day that it gradually got worse, I would say it hasn't gotten worse than that. No.
Okay. And this stomach pain, this ever previously happened to you before?
Not this type of stomach pain. I've had like stomach aches and stuff, but this kind of feels a little bit different.
Okay. How would you describe this as different than any previous stomach aches that you've had before?
Um, it's just kind of like the stomach pain I've had before was kind of just like I could feel that it was after eating, or like um, certain things I would stir at my stomach. But this doesn't really feel like my stomach. It's just kind of like radiating pain and tender to the touch there.
Okay. How would you describe your abdominal pain? Would you describe it as sharp, as shooting, dull, or aching?
Just kind of like radiating, aching, kind of.
Okay.
Yep.
Okay, and you said radiating. Where does it radiate to?
Just that general area, not any other quadrants, but just like it'll feel like basically in like a little bit of a circle, like in this area, just
Okay.
like being around there.
Okay. And it doesn't translate to your back at all?
No,
Radiate? No. Okay. And again, on a scale of 0 to 10, where would you rate that abdominal pain?
I would say that's about a 7 or an 8.
Okay. So that's a little bit more than the
Yeah.
tiredness. Okay. Uh, and is it persistent for you? Or is it
And it pretty much lasts
fluctuate?
all
Okay.
day.
Okay. All right. And are there any other symptoms that accompany your tiredness and the fever and the abdominal pain?
Not that I've noticed. No.
Okay. All right. I'm just going to go through some general things, ask you some questions, kind of going to be on a yes or no basis. Okay.
Mhm.
So, what is your usual weight?
Usually about 180.
Okay. And has there been any recent changes to your weight?
Yeah, I weigh about 175 probably now, and nothing too crazy, but
Okay.
I've kind of noticed like a lack of appetite, I guess.
Okay. And has that happened very quickly, would you say?
Um, it wasn't a severe weight drop. It was in about a week, probably. So I guess it was a decent amount, but it wasn't over like 1 day span or anything.
Okay. All right. Do you notice that your clothing fits more loose or tight than before?
No, it's about the same.
About the same. Okay. And do you have any sort of weaknesses that you've noticed?
I just generally feel weaker in terms of strength, but not any specific body part or anything like
Okay.
that. Just
Okay. And you said that you have been feeling fatigued and tired, correct?
yep.
And that you do have a fever.
Hmm.
Okay. All right. Next, I'm gonna sort of work off of your abdominal pain. Okay. Just give me a second. Have you noticed, do you have any trouble swallowing?
I have not.
Okay. Have you had any heartburn?
I have not.
Okay. You said your appetite has been more poor recently?
Yeah, a little bit. I feel like that's just kind of coming along, just like with the fever and just feeling weak. I just don't have any motivation to eat just because I feel weak and it just,
Okay. Yeah, that's totally understandable. Okay. Have you been feeling nauseous at all?
no,
Okay. Have you noticed any irregular bowel movements?
no,
Okay. Has there been any changes to your stool color or size?
no,
Okay. Has there been any changes to your bowel habits?
no,
Okay. Have you experienced any pain with defecation?
no,
Have you had any rectal bleeding or black or tarry stools?
no,
Have you had any hemorrhoids?
no,
Have you had any constipation?
no,
Have you had any diarrhea?
no.
Have you had any abdominal pain? Yes.
Yep.
Have you had any food intolerances?
Not specific foods, just no, no,
No? Okay. uh, have you experienced any excessive belching?
no,
Have you had any excessive gas?
no,
Have you noticed any sort of jaundice or yellowing of your skin?
no,
Have you had any trouble with your liver in the
no,
past? No. Have you had any trouble with your I'm sorry, gallbladder in the past?
no.
Okay. And do you know, have you had hepatitis?
No.
Okay. All right. All right. So now I'm going to move on to any medications that you might be taking. I know you said that you don't really want to take over-the-counter medications, but I just want to see if you are taking any for past medical reasons or anything.
No, I don't take any prescription medications or anything, but the only thing I do take is just 5 grams of creatine per day, just because it helps me recover for cross country and track.
Okay. All right. And the dosage of that?
Oh yeah, 5 grams.
Okay.
Okay.
And what route do you take that? Is that a
Uh,
powder? Is that a pill?
yeah, it's a powder. I just mix it in with water.
Okay,
And
great. And how often do you take that?
I take 5 grams per day, once per day.
Once a day. Okay. And have there been any recent changes to your dosage, would you say?
No, that's yeah.
Okay. And how long have you been taking that?
Probably about a year and a half to 2 years, I would say.
Okay. All right. Now I'm going to move into allergies. Okay. So have you had any allergies in the past, even childhood related or any more recently?
Not that I know of now.
Not that you know of. Okay. Just going to clarify. Okay. So do you no latex allergy?
Mm-mm. Nope.
Okay. No iodine allergy
No.
and no chlorhexidine allergy.
No.
Okay. Right. Moving into past medical history. Okay. So did you have any childhood illnesses?
No. I feel like I was pretty healthy as a kid.
Okay.
I tried to eat healthy back then too, so I feel like I was
Great. Yeah. That's awesome. Okay. And again, just to clarify, a yes or no will simply do. Okay. So no history of the measles,
no,
no history of mumps,
no,
chickenpox,
no,
rheumatic fever,
no,
scarlet fever,
no,
polio,
no,
psychiatric disorders.
no.
Okay. And again, yes or no. Okay. Just asking about childhood immunizations. Okay. So do you know were you vaccinated for polio?
Yes,
Yes. Okay. How about measles, mumps, and rubella?
yes.
Okay. How about the flu?
Not this year, but I got it last year.
Okay. Tetanus?
Yes,
Okay. Diphtheria?
yes,
Pertussis?
yes,
Hepatitis B?
yes,
Chickenpox?
yes,
And pneumococcal?
yes.
Okay. So again, those were childhood illnesses. You said that you were pretty relatively healthy as an adult, but I just want to double check. Have you had any adult illnesses that I should be aware of?
No, I don't think so.
Okay. Again, I'm going to be asking yes or no questions. Okay. So do you have any history of hypertension?
No,
Okay. Any diabetes?
no,
Tuberculosis?
no,
Okay. Heart disease?
no,
Lung disease?
no,
Kidney disease?
no,
Thyroid disease?
no,
HIV?
no,
Seizures?
no,
Cancer?
no.
Asthma or COPD?
I have asthma and no COPD.
Okay. So with the asthma, do you take an inhaler with that?
Yeah, it doesn't really flare up now. It did when I was younger, but I do have an inhaler just with me at all times, just in case, especially with cross country and track.
Okay. Is your asthma sports induced, or what are your triggers?
It was sports induced when I was a child, but it is no longer.
Okay. All right. I'm just going to add that to your medications. Okay. Um, and the dosage for that inhaler.
I don't know off the top of my head, honestly.
Okay. And the route, is that just orally,
Yeah.
the puff? Okay.
Yep.
And as needed, correct? And
Yep.
there's no recent changes to that dosage for you.
No.
Okay. All right. Again, going back to my long list. Okay. So, uh, any history of hyperlipidemia,
No.
any blood clots,
No.
or hepatitis?
No.
Okay. All right. Next, we're going to move on to any sort of previous accidents or injuries that you might have had. Okay. So have you had any previous accidents or injuries?
Yeah, I broke my toe in 8th grade, and I had to get surgery to fix that.
Okay. All right. And what was the outcome of that surgery? Did you go to physical therapy or?
No, they said once I did the surgery that it would heal on its own, so I didn't have to go to PT for that. But it healed all fine. I just had to go back for a couple follow-up appointments, and
Okay. Do you happen to remember the date of your injury?
um,
You
I
said eighth grade, so I guess approximately the year.
yeah, I guess it was 2017.
Okay. All right. And you said you broke your toe. What toe was that?
It was my big toe on my right foot.
Okay. All right. And were there any complications with that surgery that you had?
No.
Okay. And again, the outcomes were positive.
Hmm.
Okay. Any hospitalizations that you've had, including any sort of psychiatric or detox hospitalizations?
Besides when I broke my toe and went to the ER and then was admitted, I've never been admitted to a hospital other than that.
Okay, great. All right. And any other surgeries besides that one time?
No, that was the only one.
Okay. Next, I'm going to move into the health maintenance section. Okay. So you, I think, had previously mentioned that you didn't get your flu shot this year.
Hmm.
Okay. Um, have you kept up with hepatitis B?
Yes.
Okay. Zoster vaccine,
Yes.
pneumonia shot.
Yes.
Okay. Colonoscopy. I know it's probably not.
Yeah, no, I
Yeah.
haven't.
Okay. Prostate testicular exam.
I think my primary care provider has done that. Yes.
Okay. A DEXA scan.
I'm not sure.
Okay. uh, how about TB test?
I have been tested and the result was negative.
Okay, great. A cholesterol test?
I think my primary care doctor has gotten blood tests done, but I don't really know the any of the results. I just know that there's nothing that I should be worried about or changing my diet for.
Okay. All right. Okay. So next I'm going to move into the sexual history portion. I ask this for all of my patients. Okay. So it's nothing new. Um, so are you interested in men, women, or both?
Women,
Okay. And how many sexual partners have you had in the past year?
um, the past year probably 5, I guess.
Okay. And do you use contraception or condoms or anything?
Yeah, we use condom. I use condoms. Yes.
Okay. Uh, do you use any laxatives?
I do not.
Okay. And do you have any alternative health practices?
I do not.
Okay. Do you use any street or illicit drugs?
No.
No. Okay. Okay. Next, I'm going to go into any past psychiatric history. Okay. So, as it is common through the population, I like to ask all my patients about their history about psychiatric disorders. Okay. Um, so, have you had any previous contact with psychiatric services?
I have not.
No. Okay. Any previous history of self harm?
No,
Okay. And have you ever been admitted to a psychiatric facility?
I have not.
Okay. Next, I'm going to dive into family history. Okay. So I'm going to just ask about your immediate family members. So any of your brothers, sisters, as well as your parents and your grandparents. Okay.
Mm.
So include the age and the death age for your grandparents or any of your siblings or your parents. Okay.
Right.
And as well as the cause of death. Okay. Okay. So do you have any conditions that run in the family?
I know that my dad's dad had stage 2 colon cancer,
Okay.
but he did not die of that. He's still alive today.
Okay. Do you know at what age was he diagnosed?
He's diagnosed at age 55.
Okay. All right. So that was your paternal grandfather, you said?
Yes.
Okay. And what age is he now?
He is now 75.
Okay. All right. And how about your father's mother? So your paternal grandmother?
She had no history of colon cancer.
No history of colon cancer.
Uh,
Any history of
no history of
any?
any.
Okay. Any other history associated?
Not with her now.
Okay. And how old is she?
She is 68.
Okay. Great. And next to your mother's father, so your maternal grandfather. So any uh, health history associated with him?
Yeah, I think he had a little bit of high blood pressure,
Okay.
or is
And,
still.
and is he still living?
Yeah, he's still living. Yeah, but he does live with hypertension.
Okay. And what age is he
He
currently?
is 83.
Okay. And your maternal grandmother, so your mom's mother.
No, she's generally pretty healthy. I don't think she has any underlying diseases.
Great. Okay. And how old is she?
She is 80.
Okay. And your father, any past medical history that you're aware
Um, he has ulcerative colitis.
of? Okay. And how old is he?
He is 48.
Okay. And what age was he diagnosed with that ulcerative colitis?
I think it was when he was around my age, so I think around like 17 or 18. I remember he just said it was in high school.
Okay. All right. And your mother, any past medical history associated?
No, she's generally pretty healthy.
Okay. And how old is she?
She is 47.
Okay, great. And are you an only child? Do you have any siblings?
I have two siblings.
Okay. And how old are they?
I have a 13-year-old brother and a 6-year-old sister.
Okay. All right, great. Okay. Any other family members?
Nothing,
No.
nothing that I can think of that
Okay.
too dramatic.
Okay. So I'm just going to ask a certain number of questions, and you tell me if they you've heard of them running in your family at all. Oh, we're done.
All right.
How do I stop this?